Today I'm going to talk about the transition dairy cow, the biology and management. So first of all, I give you some concept about the transition cow. So we know in a typical year, the cow has about 60 days dry period when they do not produce milk, and have a 305 days lactation period when they produce milk. So we know a cow has to calve to start the milk production. So several decades ago, a lot of research has been focused on the period transitioning from late dry to early lactation. And we call this transition period. It's about 3 weeks before calving to 3 weeks after calving. So why do we care about this period? Because in the dairy industry, typically the cows do not like a happy life like this. Actually, transition period is the most problematic time of a dairy cow's life. So just give you a concept of some of the changes in this period. So from an environmental perspective, the cow just finished the previous lactation, so they're going to enter the dry period. And the farmers will move the cows to the dry group when they started a relatively high forage diet. And about 2 to 3 weeks before their expected calving, they will be moved to a maternity pen or calving pen ready for the baby. So once they have a baby, they'll be separated from the calf, and then will be moved to the fresh group or the early lactation group to start a relatively high concentrate diet to support their milk energy output. So as you can imagine, in this short period of time, there are a lot of movements and environmental changes can cause certain stress for the cow. So one important characteristic of a cow is decreased feed intake and increased lipid mobilization. So it's very ironically, actually about 20 years ago, an excellent study demonstrated the cows had a decreased intake as she approached to calving. And although the feed intake increased dramatically after calving, it does not match up with the milk energy output. So the modern genetic selection and improved nutrition and management make the cows produce 50 times more milk as they would naturally produce. So what happened is the cow going to lose body weight and mobilize their fat tissue and release this free fatty acid of FFA to the blood. The purpose of FFA is to go to the mammary gland and support milk energy output. But this causes hyperlipidemia, or like a high level of free fatty acid in the blood, which is associated with all kinds of metabolic as well as reproductive issues. So just show you a picture here. So I took the picture for the same cow before calving and after calving. As you can see, the cow becoming more skinny after calving. Actually, a study showed about the cows can easily lose 10% of their body weight in the first 10 days of lactation. So they doesn't really look very good. And associated with all these changes are increased health disorders. So one of the, as you can see, a review paper summarized what changes in the transition period. As you can see, the x-axis shows the day relative to calving. So compared to the rest of the lactation, really around the calving, either the first lactation heifer or older cows, they have a dramatically increased chance of getting disorders. So now you may wonder, what are these problems? So the most important metabolic disorders are ketosis and fatty liver. As I just briefly mentioned before, the cow mobilizes adipose tissue, release FFA to support milk production. So at the same time, the FFA will end up in the liver. It can be completely oxidized to produce ATP to support normal function of animal. But the excessive level of FFA will also go through another pathway, kind of overflow. So we call it partial oxidation, produce ketone bodies. So ketone body, to some extent, can provide energy for milk as well. But the excessive amount will cause nerve damage as well as make them go off feed. So there's a disease called ketosis, which may affect up to 50% of certain herds of the dairy cows. So the third way for the fatty acid is become re-esterified, becoming triglyceride. So the cows are not really efficient to export the triglyceride out of the liver, so the fatty liver occurs. As you can see from the picture here, liver turned yellow, and under microscope, the normal liver cells are replaced by this white lipid droplets. So liver is very important in the metabolism as well as produce glucose. So as you can see, the fatty liver may have a direct effects on impairing the health and the metabolism, and subsequently the production of cows. So in addition to metabolic problem, one important digestive problem we call displaced abomasum. So we know the cows have 4 stomachs. So the big one here is a rumen. It's the biggest. It accounts for 80% of the digestive tract. So the abomasum I use A here is a chew stomach, which is like a human's stomach, to secrete acid and digest some food. So normally, from the rear view, the abomasum is in the right side of the animal. So because of metabolic changes and the cows do not have enough feed intake, create some of the empty space in the gut. So in certain cases, the abomasum can be easily shift to the left side and twist it. So as a result, the feed stuff cannot pass the abomasum and go through the small intestine to be digested. So the cows will further decrease feed intake because they don't have any appetite anymore because the feed path was blocked. And also they feel very pain. So just a picture show you here, this disease do require surgery, the vet to go to get the abomasum back to the correct position, and it's very expensive and it's probably not a happy experience for the cow. So in addition to those problems, there are some other problems with reproduction, reproductive tract, and the mammary gland. So the top one show you here called a metritis. It is an infection of the uterus. So we know after cow gave birth, their reproductive tract is open to the environment, so increase their chance to get infected. On the right side, I show you the retained placenta. So ideally, the cows have to expel the placenta after calving within 12 hours. But sometimes they can have the placenta hanging there for 1 or 2 or even more days and dramatically increase their chance of gut infection. So actually, metritis and the retained placenta are closely related. So the most costly infectious disease in dairy cows is mastitis. It costs about $2 million per year. So mastitis is inflammation of mammary gland, typically caused by some of the bacteria from entering into the tits and growing the mammary gland and cause all problems. The cows have abnormal production of milk and a decreased milk quality. So study find there are dramatically increased chance of cows to getting mastitis during the transition period, possibly associated with their decreased overall immune function during this time. So why do we care about all this problem? So the transition period directly determines the production, fertility, health, longevity, as well as the welfare of the animal. And from the farmer perspective, they really care about the profitability of the industry. So it's just to directly affect whether they're going to be profitable or not in the next lactation. So what are the keys to a successful translation? So I will not introduce you the detailed methods to treat each individual disease, but some of the tips may be helpful for the general herd management perspective to prevent or minimize the occurrence of some of the problems. So first one is minimize stress. So we know stress causes problems, so we want to avoid unnecessary pen movement. We want to keep the stocking density smaller than 100% and give the feed bank space around 85%. So we don't want to put too many animals into the pen when they have too much interactions or fights. And some dominant animals really occupy more than one bunks, while some other subordinate animals do not have access to the fresh feed or do not have the chance to get enough food. And also we want to maximize comfort. For example, we want to provide clean and comfortable beds for them to have enough laying time to have a rest, and especially give them cooling during the heat stress. As you can see here, in a lot of states in the United States, the summer is really warm, so we want to give some fans coupled with the sprinkler of the water. Typically, people put in the feed bunk, so encourage the cows to come out and eat. And third, we want to maintain prepartum dry matter intake. So as you can, I show you the picture before, the cows decrease dry matter intake, which is associated with the problem. So we want to control the dietary energy density. A lot of research have shown high energy diets predispose cows to health problems. So we really want to prevent obese cows, which they probably going to mobilize more lipid after calving and cause more hyperlipidemia and associated with other problems. And next, we want to maximize postpartum dry matter intake. So studies find that dry matter intake postpartum are positively associated with the milk production. So to do this, we want to deliver a palatable ration including the appropriate moisture, particle size, fiber, and fat content. Some additives, feed additives may be helpful, such as choline, niacin, monansin. This can modulate the lipid and glucose metabolism and decrease the risk of getting diseases. And finally, we want to monitor health and performance. So ideally, especially at the research herds at university, we can easily monitor their feed intake. So the intake is directly related to their overall health. If you catch animals go off feed, just give her treatment as soon as possible. And also, if we have some people to monitor the health and give appropriate treatments in a timely order, that would be dramatically decrease the chance that the cow have a prolonged disease. So to summarize my talk, the challenges of transition period, including the calving stress, hormone changes, decreased feed intake, and body weight loss, and most importantly, increased diseases. So the keys to a successful transition, we want to minimize stress, maximize comfort, maintain prepartum dry matter intake, and maximize postpartum dry matter intake. And we also want to monitor health and performance. So thank you very much, and I'm happy to answer any questions.